Hi everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to continue talking about visual rehabilitation. We're going to be talking about a clinical test called the Worth-4 dot or the Worth-4 light test. Some will abbreviate it as W4LT. We're only going to be talking about it in a very simplified fashion. It can be much more complex with all the results and interpretations. We're not going to go into all that today. Now, the Worth-4 light test, this is a simple clinical test that assesses a few different things. First, it assesses our binocular vision, and this just means that we're using our eyes, both of our eyes together, to perceive our surroundings. It also looks at our binocular single vision. So this is a more specific term. It means our ability to merge the input from this eye and this eye so that we see a single image and not two separate images. It's also used to detect suppression. This is a term that means that when both of our eyes are open, the brain is not processing the input from one of our eyes. This can occur in certain conditions, such as if someone is cross-eyed or if one eye is turned more in or out, basically the eyes are not fully aligned, or even after a neurological event. The typical formation of the lights, the red light is going to be the top light. The two green lights are going to be on the side, the right and the left, and the bottom light is going to be a white light. They form a diamond shape. Let's talk about how to perform this test. If the person wears corrective glasses, they should be wearing them for the test. They're also going to be wearing something called red-green anaglyph glasses. So over the right eye lens, it's going to be red, and over the left eye lens, it's going to be green. The red lens is going to filter out the green light, and the green lens is going to filter out the red light. In the room, you want to dim the lighting just so they can see the lights better. And it's important that before the test, you don't let them see the number of lights. You can test this for distance and for near. So if it's for distance, the person is going to sit about 6 meters away, which is about 18 feet away from the light source. For the distance test, it's often a light box. And for the near test, they're sitting about 33 centimeters away or about 13 inches away from the light source. The light source for the near test is usually a flashlight. It's very important for the clinician to ask certain questions, such as how many lights do you see and what colors are the lights? Where are the lights located? Are the lights all in a line, or are some higher and are some lower? Do the lights show up all at one time, or are they flashing on and off? Let's go over how to interpret some results. If they tell you, I see 4 lights, the red one's on the top, the green is on the side, right and left, and the bottom light is yellow or orange, this is correct because it's due to the fusion of the red and green light for the bottom light. So our interpretation would be normal binocular vision or manifest squint. So manifest squint is when you can visibly see that their eyes are not aligned, but they still tell you, I see 4 dots and all the dots are in the right place. Sometimes people who have manifest squint, they may still see the normal result of 4 lights. We may call this binocular single vision with something called ARC or abnormal retinal correspondence. Basically, that just means that their brain has adapted and rewired things so that they can see one image instead of 2. Remember, this is a condition where I can look at them and see that their eyes are not aligned properly, and yet their brain has allowed them to see one image. If they tell you, I see 3 green lights, our interpretation is going to be right eye suppression. If they tell you, I see 2 red lights, our interpretation is going to be left eye suppression. If they tell you, I see 5 lights, 3 green and 2 red, this person has diplopia or double vision. If they tell you the 2 red lights are on the left and the 3 green lights are on the right, this means they have something called crossed diplopia. If they see 5 lights, but the green lights are on the left of the red lights, so the red lights are on the right, this means they still have diplopia, but we call it uncrossed diplopia. And eventually I'll make another short video just to explain a little bit more of how we come to interpretation of these results. There are also other results that are possible. They can have the dots or the lights vertically stacked. We can call that vertical diplopia. Sometimes the dots are not stacked directly on top of each other, but they might have some horizontal distance in between. This is typically called mixed deviation, but again, there are so many different possibilities. We're not going to be going into that level of detail in this video. We're just going over some of the common results seen and how to interpret those. Again, I'll make another video that goes into more detail of how we come to the conclusion or the interpretation when we have those results. All right, this is a really short video. I hope you liked it. If you did, like and subscribe. See you next time.